Just take a video of 1 minute, and then after that it will give out your parameters, your vitals like your blood pressure, your oxygen saturation, your hypertension risk.
I must tell you that just before this interview, I downloaded the app and I actually did the process. I have to ask you, the technology behind it, how reliable is that data?
This is photoplethysmography, okay, combined with a lot of algorithms and artificial intelligence.
So, what you spoke about the technology, the photoplethysmography, if I got the pronunciation right,
That
can
is
you
correct,
break
yeah.
it down for us in terms of how does that work?
What happens is the light, okay, the light, any light, whether it's indoor lights or actual natural light, it gets into your arteries. Like if the light is radiating through your skin layer, and it is actually measuring the volume of blood flowing through your arteries per second per minute, okay, and the light hits and it goes back to the camera, correct? So that speed, that volume, everything is calculated.
Imagine an AI driven app through which you can check certain health markers like your blood pressure, hemoglobin, stress levels, among other things, all within seconds. And all you have to do is upload a selfie and the app does the rest. That's exactly what Quick Vitals offers. How does this work and how reliable is this data? To talk about all of that, joining me on the show is Harish Bisam, the founder of Quick Vitals. Harish, thank you so much for joining us on the show. So, is it really that simple? Just take a selfie, upload it, and the app does the rest?
Yeah, Avni, first of all, thank you. Thank you for the opportunity to present our product here, and which will help the masses, which will help the broader community, because this is accessible, adaptable, and very affordable. So that's why I'm very thankful for you to give this opportunity to me to bring this to the whole world, especially to my motherland, India. Right, so now coming to your question, it is very simple. You just take a video of 1 minute. So the video goes on for 45 seconds to a minute, like a 60-second video, and then after that it will give out your parameters, your vitals like your blood pressure, your oxygen saturation, your hypertension risk, your diabetes risk, and various other components, your stress risk as well, your stress level as well. In the next edition, we are going to bring in cholesterol risk as well. It's as
Okay.
simple as that. The technology behind it is massive. There's so much technology. It's not rocket science, but it's very, very simple.
Yes. So, Harish, I must tell you that just before this interview, I downloaded the app and I actually did the process. I uploaded a selfie and then got all my health markers. So, I have to say it was a very smooth process and it gave me exactly each of the health markers, explaining what each means and overall what it means as well. But I have to ask you, the technology behind it, obviously it's AI driven, but specifically for it to be able to sort of read my face and give me all of that health markers, how reliable is that data?
Yeah, this is again, like I mentioned before, it's not rocket science. This is photoplethysmography, okay, combined with a lot of algorithms and artificial intelligence. There's a lot of, like, for example, you have used it now, keep
Yeah.
using it every day, okay. In 1 month's time, try now the variance would be around 1 to 2% with any other traditional equipment, okay, if you compare, okay, comparatively, I mean, okay. But in 1 month's time, your variance could probably be zero or just above zero. That's how good it gets. You keep using it, it gets better and better and better. And coming back to the technology itself, like, you know how the oximeter works, like they put an
Yes.
oximeter, right? Similarly, that is photoplethysmography, kind of one way of photoplethysmography. There are a lot of ways people use photoplethysmography. This has been used since ages, right? Since long time now. Okay, they use especially for on the heart, okay, heartbeats and heart volumes of blood in the heart and all that. So that has been used. So what we have done, our technicians, our technical team, scientists, and there's a lot of research happening on this particular process, right? So we have adapted that photoplethysmography, and we have put it onto your phone. Light should be good, okay, and the distance, and your phone should not be, your hand should not be away, like that's what it needs. And then when the actual light gets into the arteries and that signal is gone back to the phone, this data set is sent to the algorithms at the background, and those algorithms do all the calculations and give you your data, so your vital set back to you. It's as
Right.
simple as that.
Okay. So what you spoke about the technology, the photoplethysmography, if I've got the pronunciation right,
That
can
is
you
correct,
break
yeah.
it down for us in terms of how does that work?
What happens is the light, okay, the light, any light, whether it's indoor lights or actual natural light, it gets into your arteries, okay, like if the light is radiating through your skin layer, and it is actually measuring the volume of blood flowing through your arteries per second per minute, okay, and the light hits and it goes back to this camera, correct? So that speed, that volume, everything is calculated, and this data is actually sent to algorithms in the back of the phone, like which is already there in our app, in our tool. I've seen another product recently being released. They're talking about a band, like it's like a sport band, like a sweat band on your forehead, but that radiates a light. It illuminates. There is a light coming up, and that particular band sends detail to your phone, like that sends some signal, some information to your phone. And in your phone there is a lot of activity happening within the algorithms, and that those algorithms actually do what they are supposed to do and give you your vitals information. What we are trying to do is, without that sweatband, there's nothing except your phone. So
Hmm.
that's the whole point. We want it to be very affordable, accessible, and wherever you are, you don't need to wear a band, you don't need to wear a watch, you don't need. That's the whole point. You don't need any exact extra gadgets, right? It's all about your phone. Your phone is in your pocket. You are using it for your payments. You're using it to communicate with other people. You're using it for everything these days. Your phone is your life, kind of, right? You hold that in your pocket. Why not health? If you are healthy, you can do everything else. So that is what we are telling people. So use this opportunity and use this tool, which is just on your phone, and just which will give you your vitals in 1 minute's time.
Right.
That's it.
So for even things like the Apple, for example, Apple users for the iPhone, they have the health app, then the Apple Watch is there. How does this compare to such other products that are there in the market?
Yeah, exactly like before I said, right? With Apple Watch, you have to buy the watch. If you go to
Right.
regional India, you can't buy. A lot of people would not have an Apple Watch. Number one, and health app doesn't do what we do. Like if you
Hmm.
compare our data set, you can see what we do. We do oxygen saturation, we do
Yes.
hypertension risk, we do cholesterol. Sorry, cholesterol is up, will be updated in the next maybe in January or February. But we do diabetes risk, hypertension risk, oxygen, everything. But when you want to do something on your phone, you have to touch something, right? You have to put your finger here, then it communicates with your watch and all these things. Here we are not saying don't touch anything, and you don't need a watch, or you don't need an armband, or you don't need any extra gadgets. All you need
Hmm.
to do is maintain a safe distance, and it is very affordable, and it is accessible to everyone. A normal rickshaw man or any person in India, or globally, is using a smartphone these days. Okay, that is what you need. Okay, and it is very, very affordable. It's cheaper than chips. Yeah, that's what it
Right.
is.
Right. So, Harish, what's been the response from the medical community? For example, would doctors be comfortable with prescribing medication or treatment based on data from this app, or would it be used as a marker for further traditional testing before getting any kind of a diagnosis or prescription?
I think it is a combination. It should be like a combination. So, uh, to answer that question, I'll start with we this quick vitals thing, like or any other technology that will follow this, right, is all about complementing the current traditional system rather than complicating or competing with them, right? What we are trying to do, basic parameters, basic vitals, you actually measure on the app, and doctors can give the medicine based on the app, okay? but you are
Hmm.
constantly seeing something. Like, let's say there is diabetes risk, that your blood has to be checked, your lipids, your there are a lot of parameters that needs to that there are a lot of other chemicals, there are lot of other blood tests that needs to be done with the actual blood to find out exactly how diabetic are you, what kind of glucose, sucrose, sugar levels are there, what is your insulin doing in your body. There are a lot of other factors that need to be considered. But can you go to a diagnostic center every day? You cannot. So what I'm trying to do is use this tool. It will tell you whether you are at a risk, whether your parameters are good. If you are decent enough and you are in the borderline, you can probably go away with the medication without actually going to any blood test. But we always say one thing, just use the tool to identify, okay, whether you detect, early detection, identify a risk, and then you feel like 4 days continuously your tool is telling you you are pre-diabetic, you are at diabetics risk, diabetes. Today, let's say I have 4 coffees with sugar, and suddenly I'm testing, and my sugar has a spike, and it is showing me I'm at a risk, okay, with for diabetes. So you actually don't worry and don't run to a doctor straight away. Okay.
Hmm.
If your system is telling you every day that there is something wrong with you, okay, your hypertension, you are at hypertension. If it's saying continuously for a couple of days, that means there's something wrong, right? Go to a doctor, get everything checked properly, and then you take your medication according to your doctor's advice.
Right. Harish, I have to ask. I mean, you're saying that the more you use the app, the more the data is, gets more and more credible, so to speak. But
Yeah.
that means regular, daily using the app to try and figure out your health markers. Doesn't that also kind of fuel maybe somebody who has hypochondria, is a hypochondriac, so to speak?
Yes, but when I'm saying the regular use, okay, if
Yeah.
you when by saying regular use, what I mean to say is if with the variance of the vital screening will be very less. That's what I meant to say. Let's say you use, I don't want to name names. Let's say you use a blood pressure equipment, okay, of a particular company, and you use another company on your hand. There will be a variance of 1 or 2%. Okay,
Hmm. Hmm.
so when you use our product, your variance is probably 1% or below 1% most of the time. Our variance is very, very low. But you
Hmm.
keep using it, your variance goes to zero almost. That's what I meant to say. But the
Okay.
variance is actually very low. And again, we, this should be a habit. Coming back to, your actual question, a lot of people, especially after COVID, they're dropping dead, just like that.
Hmm.
If you have seen that, you probably know now, right? People are
Yeah.
have dropping dead because of the heart issues, and there's so
Hmm.
many hypertension issues. The
Yes.
number of brain hemorrhages have gone up. Why? Because it's not possible to keep a tab on your health every day, but this
Hmm.
tool will help you. It is, we don't want people to panic. We don't want people to panic at all. We want people to take the advice, use this tool, use this app for their better life. It's not about panic. Something is wrong, go straight away to your doctor and get medical advice and proper tests done, and start taking medication. This is what it is all about. It's not about creating a panic. It's all about creating a healthy lifestyle. We think that it creates some kind of uh, tremors or some kind of panic in the society. But I think people are worried deep in there, okay, but they
Hmm.
don't use it. Why not?
Hmm.
Like, when I tell you, there is an opportunity for you to use it and identify if there is any risk. If there is any risk, go and take care of it. Get proper advice and follow the medication given by your doctors.
Right. The other question I had from the app perspective, technology perspective, if I download the app in my phone, then can I use it on a number of people? If, say, in remote areas, somebody does, everybody may not have a smartphone to sort of use the app. So, is it possible for one person to sort of use it for various variety of people?
No, there's two different models to it. One is your quick vitals, right? When you use your quick vitals, there's that data set is stored in there, okay, within your phone. So when the next data set goes, it actually is building a case on you. Okay, so let's say you use it and then someone within your family uses it. So it's actually there is a conflict of data. The
Right.
variance could be completely, the result might be completely different. And there is another model that's something our developers are working now. It's called Swast India. That is more for tribal India and a single use. But
Okay.
what will happen there is, once you use it, once Avni uses it, it nullifies, it deletes the data. Like there is
Okay.
no data set stored in the system, in the phone. So Harish can use it. Then it can be used for 100 different people. So that's how we are developing another one where there is no conflict and it gives you better results.
Okay. What about user data? You said there's one model where the data you're developing, which the data will get erased from the phone itself. But the data which is already there in the other model, where is it stored and what measures are taken to ensure privacy of health data?
Yes, we that is our paramount. That is our top priority to protect the data. Okay, so we follow all the guidelines in each country. Australia has its own guidelines, India has its own guidelines, and I think it will get more stringent and stricter in India. So we follow all the guidelines provided by the government of any particular government and global data set rules and data privacy rules as well. Okay, so most of the personal data, like if you have checked it, okay, you just told me you have checked it. I would know that someone called Avni has actually downloaded it and Avni has used it, but I would not be able to see your actual
Okay,
results. It is only those reports are stored in your phone only. We will not
got
be
it.
able to access it unless until you want us to, you give access to your reports and you send them to us to get
Hmm,
them checked or something like that. Otherwise, we will not be able to access your reports. No.
got it. Got it. Harish, what's the moat for quick vitals? Because health tech now, especially with AI, is getting to be a very crowded space. So, what's the differentiating factor here, and what prevents others from using AI to provide a similar service?
Yeah, accuracy. Okay, Quick Vitals is very accurate. There is another competitor. I don't want to name them. Okay, but I know the founder. I know the people behind it as well. We have
Okay.
checked the we have checked the vitals. We met last week. I've checked their data. I've checked their accuracy as well. Our accuracy is very good. Our variance is very low. I can guarantee you that when we did the soft launch, it was
Hmm.
done in front of 20 different media houses. Okay, and there were like 45 doctors and 50 or 60 people from IT fraternity, right? I purposely called different set of people so that I get good criticism and a good evaluation of the product because I wanted to know, and I've actually tested it on myself while I
Hmm.
was showing my blood pressure on my phone. Okay, heart rate on my phone, and I put a blood pressure gadget, like the equipment thing on my phone. Okay,
Right.
electronic BP equipment on my arm, and I've actually tested it straight away. And I purposely did some push-ups to bring my heart rate up. Okay, and then it was exactly on the dot to dot from the
Okay.
iPhone to Quick Vitals. Okay, coming back to your question, this is very affordable and it is accessible. It's in your pocket. You want to check your heartbeat, you want to check your blood pressure, you want to check your if you are at diabetic risk, you know I'll take example of my wife. Whenever she's lethargic, she's bit tired because of all the chores she does for us and for me and my kids, right? She keeps saying, "Oh, my sugar is low. My sugar is." This is very common word people use. My sugar is
Hmm.
low. It's not
Hmm.
your sugar. Your sugar is not. I keep asking. I used to take her to the doctors, especially when we go to India. I keep get checking her blood for sugars, right? And her sugar is always normal. Now she uses quick vitals all the time, and she says, "Oh, my blood is good. My blood is good." It's it's very common, and it
Right.
becomes a habit. And as soon as you see something is wrong, okay, something is going beyond your control, go to the doctor, get it checked properly, get your full bloods done, and follow the doctor's advice.
Right. So, what's the long-term vision for Quick Vitals expansion plans? Where do you see it heading in the next, say, 5 to 10 years?
Yeah, but there's lot. Quick vitals did not start because of quick vitals. It has started as a as a tool which needed to be integrated with another product, Doctors Plus, which is more of a medical tourism. Okay, it's
Hmm.
that vehicle is much larger. Okay, so you will see more and more improvements within Quick Vitals itself. So when we were actually working on Doctors Plus for medical tourism to India, right, we have identified some gaps within the diagnostic. I didn't want patients to put their finger here and
Right.
go somewhere and get the basics done. To get the it should be a seamless service. That's what I wanted, right? But it
Hmm.
wasn't happening. That's how Quick Vitals has actually evolved, to be honest.
Hmm.
Okay, so when that has happened, we identified Quick Vitals can itself go as a product which can help people live a healthier and happy life. So that's how
Hmm.
we've rolled out Quick Vitals. But in the next few months, you will see cholesterol risk also. After that, you will also see a lot of other things coming up within, a lot of other improvements coming up within Quick Vitals, and we will integrate. We have already integrated with this uh, with our Doctors Plus, which is more of a tele specialist product. Okay, so that product will actually connect a lot of doctors in Australia with specialists in India. Okay, it is a different service, but that is not rolled out commercially yet. That is something which is going to happen. So this is only step one. We have 20 steps to go. We are still at the step one.
Right. What about funding requirements and plans going forward, path to profitability? What kind of numbers can you tell us about the downloads, the usage?
So profitability is, we haven't reached that stage yet. So we are actually going to commercially roll this out from first or second after Diwali. We were waiting for Diwali, and we were
Okay.
actually making some changes for to the look and feel and all around the packaging of the product itself. Okay, people like to see how it looks as well, right? It's not
Hmm.
just about what it does. They need to have good look to it as well. They need to feel happy about what they're looking at. So all these things have been worked. When we have done the soft launch, we got a lot of feedback from media, a lot of feedback, and a number of doctors gave us good feedback. So most of the feedback was all around look and feel. So all
Hmm.
those feedback has been implemented. That feedback was provided to our developers. So they worked on the product to make it better, and more user friendly too. So coming back to the funding, at this stage, it is funded by me, my family, and some of very close associates. Apart from that, when we go big, I think it will fund itself. And the way we look at it is, people, especially in India, we are very quick in adapting something good. Okay, and it is not just about making money; it is all about healthier life for people as well. So that's what the whole objective is. In the process, we make some money out of it. Why not?
Okay. All right, Harish. So let's do a quick rapid fire. I'll ask you some quick questions and quick
I'm
answers to
scared.
those.
I'm scared. I have to do my quick vitals now so that my blood pressure is not high. Yeah, let's try. Let's try. This is probably my first one. Yeah, but let's try.
Okay. All right. Let's go. What's your most memorable moment been in the journey of entrepreneurship?
Uh, Focus, staying focused on the product, on the result. Yeah.
Okay. What do you believe is the most innovative feature or the feature that you're most proud of as far as Quick Vitals is concerned?
Diabetes risk.
Okay. What's the one thing you love about your job?
Helping people.
A book that has changed your perspective as an entrepreneur.
Keynote by J.R.D. Tata. This was presented to me by Additional Chief Secretary of Orissa, Mr.
Okay.
Venugopal sir, IAS. He has given me, and I love that book.
Biggest challenge that you faced in the journey of building Quick Vitals?
Technology is it looks very easy to adapt, but it's not as easy to implement or execute.
And what's the one piece of advice you would give aspiring entrepreneurs who want to get into the health tech space?
Keep at it. Don't lose hope. things will fall in line. They will.
Okay, all right, Harish, we'll leave it there. Thank you so much for joining us and taking the time out to share your journey.
Perfect. Thanks, Avni. Thank you very much for the opportunity. Thank you.